Honestly, I really do want to thank you for mobilizing yourselves and organizing a special meeting just for me and doing such a good job of publicizing and everything. I don't usually get that kind of attention when I visit with boards, which I do often. Dr. Paul and I had started talking in the fall about having me and a member of my board come and meet with you, and at that time we were starting to, or we were actually quite advanced in our strategic planning, because as you know, the LHINs have to develop a 3-year strategic plan. We just wrapped that up just before Christmas. And so we had thought it would be timely for me to come and speak to you overall about our strategic priorities and talk about yours and see how we align together and where were some opportunities to collaborate even more, because as Dr. Paul said, we already do have a very good working relationship. But given that there's an immediate issue that's on everyone's mind, I thought what I would focus in a little bit more rather than our broad priorities, because we do look after the health of 1.2 million people across the region, which I take very seriously, and that's why I'm turning gray. And it's not only seniors, but I do want to focus on seniors' health this evening, and maybe I'll have an opportunity to come back another time and talk about our broader strategy, if that's okay with you. So what I will speak about this evening, I want to take a few minutes just to describe for you what is a LHIN, because home capacity looks like in this region. So how many long-term care home beds do we have, where are they, and how are they being used? And then I'll close just by giving you some of the highlights of where the province is going, and as an agency of the government, where we'll be going along too. So does that seem reasonable? Okay, so just to let you know, and I did bring copies of this presentation, but you do have it saved, so if you'd like to get it electronically or have copies made, you can have it, absolutely no problem. There's no proprietary rights on it. So LHINs were announced, as you know, in 2005. We fully started assuming our mandate as funders of the health system, though, in 2007. So the province of Ontario was the last province in Canada to adopt a regional model of healthcare delivery. So rather than having a central ministry of health that made all the decisions, starting to devolve decision-making to the local level. So they carved up the province of Ontario into 14 regions, and really these regions are purely administrative regions. So that's important for you to know. Citizens of Ontario can access healthcare services anywhere they choose. So if you ever are told or you ever hear you can't access these services because you don't live in this LHIN, that's not true, and let me know, because we do send letters out when that happens. So these 14 geographic areas are responsible for planning what healthcare services are required in the region, for funding those services, and for monitoring how well the healthcare system is performing. When we were created, actually replaced 16 district health councils and 7 regional offices of the Ministry of Health and Long-Term Care. So collectively, the 14 LHINs have roughly 400 employees, when you compare that to about 3,700 at the Ministry of Health. And we are accountable for half of the provincial budget, the healthcare budget. So there's about $42 billion that goes into healthcare. We're responsible for flowing half of that, so about $22 billion. In the CHamplain region, it's $2.4 billion that we're responsible for. And so we're set up as not-for-profit Crown agencies. So we're agents of the government. We're not employees of the government, though. We have a board that's appointed through an ordering council. It's a 9-member board. And the employees and the board members of the LHINs are local people. We live and work in these communities. We have ties to these communities. We use the healthcare services in our communities, so we have a vested interest in making sure our healthcare system is the best that it can be, because we will use it, our families will use it, our neighbors will use it, our colleagues will use it. More about what the CHamplain LHIN has been doing in terms of the last several years advancing care for seniors. So next slide, yeah. This is a busy slide. It really serves to illustrate that our strategy for seniors has been multifaceted and has involved every partner in our entire region. Our overriding principles are that every organization that interacts with seniors should adopt a senior-friendly strategy. We need to be thinking about how we deliver services in a way that is senior-friendly. Everything from the physical environment, lighting, adaptive equipment, to the culture, to making sure that print is large enough so people can see, et cetera, et cetera. And then we've really been trying to drive a home-first philosophy. I can't tell you how many times, and I'm sure many, many of you have lived this experience yourselves or families or friends, where a senior would be living in their community, they'd be doing just fine, something happens, often it's a fall, sometimes it's an illness like a pneumonia or something that changes their health condition. They end up in hospital. Every single day that they are in hospital, they lose 5% of their function. 5%. So if you're 2 weeks in the hospital, you can imagine that if you were cooking for yourself at home and walking, by the time you come out, you're not. And so while you're in hospital and you've lost all that functioning, people start to say, my goodness, there's no way you're going to be able to go home. So you put in an application for a long-term care home, and there you wait in the hospital. That had been our usual pattern and our trajectory for a long, long time. And we were seeing our rates of people waiting to go into a long-term care home be the longest in the province. And we were seeing people who didn't have many other options but long-term care. And so we have been really working to change that. We're not saying we need to eliminate long-term care homes. They have a role to play in our communities. They're very important and they provide excellent care. But we need to make sure that people are accessing them when it's the right time and not because they don't have any other options. So we've been implementing, and I'll show you some of those, a vast array of services along a full continuum to make sure that home and community services are available, and we've strengthened other parts of our system for seniors. So on the next slide, you can see that our three main areas have been to make sure that we have services in place to keep seniors healthy in the first place and to avoid them having to access a hospital or a long-term care home in the first place. So this is where we have some great opportunities for partnerships, things like falls prevention programs, things like wellness clinics, things like exercise programs, things like managing self-management of chronic conditions, outreach teams. So we have nurse practitioners who will go into long-term care homes, and you have that here in the city of Cornwall, to prevent someone from having to go get treated in a hospital. We have crisis intervention. When somebody is at home and is in crisis, we have outreach teams who can go. We have put in some respite beds for people who have dementia and respite services in the home for the caregivers of those people. And we've also done things like put in some crisis beds for seniors who may be victims of abuse. So again, trying to provide the necessary services to keep people healthy in their homes. Then the next piece was making sure that if a senior actually had to use an emergency department, they would get specialized geriatric services right there in the emergency department to make sure that, if at all possible, we would prevent an admission to hospital. So through our regional geriatric program, there are specialized nurses who are in our acute care hospitals. We have some here in Cornwall and in Hawkesbury. And they will see a senior person who's had more than one visit to hospital and help do an assessment and mobilize the right types of specialized services so the person can go home. We've also, throughout all of our hospitals, except for our children's hospital, put in a senior-friendly hospital initiative. So all of our hospitals are reassessing what they do and how well they're caring for seniors, and they've put in strategies to make improvements. everything from clinical protocols to appointing a senior member of the team to be a champion, to putting seniors' care right in their mission and their values of their organizations. And here, just as an example, we've also been putting a lot of investment to improve wait times in the emergency departments. You may know that here in Cornwall, the wait times in the hospital were very, very long several years ago. They have come right down, which is phenomenal. And we have invested $3 million over the last 3 years to help do that. And then the next piece was for seniors who did need to be admitted to hospital, and that happens. People need to go for surgery. People do have some conditions that they do need an admission, was making sure that there was the right kind of services outside of hospital to help people go back home. So we have put in things like restorative care or slow stream rehab or geriatric rehab or assess and restore. There's all sorts of different terminologies used out there. But essentially these are places for people to go after a hospitalization to get some convalescence, to get some rehabilitation so that they can then go on to go back home. The 32 beds that are at 2nd Street site right now are these kinds of beds, assess and restore. They are not long-term care home beds. Okay, so they are temporary transitional beds for people to go up to 90 days and then they go home. We have also 8 beds like that we put at St. Joseph's Continuing Care. So more options for people who might not be quite ready to go home immediately to get out of the hospital environment, which is not a great environment if anybody has spent time in a hospital, particularly when you're a senior, and particularly at times of the year like this, people are really sick in there, and where you can be exposed to all sorts of germs and viruses and bugs. And then the other major strategies were making sure that we had enhanced home care services way beyond the amount of service levels that people used to be able to get through the Community Care Access Center or the CCAC. So that's called Home First. And then one program that I'm quite proud of is assisted living services for high-risk seniors. You have that here in Hawkesbury, you have it in Cornwall, you have it in, out of Williamsburg. I think those are the 3 pockets, but they do extend out. So here, for example, in Cornwall, there are 60 seniors who can access care 24 hours a day, 7 days a week in their homes. It doesn't mean you have somebody that's in your house for the full 24 hours, but they can respond anytime by the press of a button. They will come to you. There's also nursing that can coordinate the other services that you might need. So that's really a much higher level of care, because oftentimes what happens with your regular community services is after a certain hour of the day, the coordinators go home and you can't access somebody at 3 o'clock in the morning. With this service you can. You can get somebody come to your house at 2 a.m. if you need it. And some of the seniors who are on this program might have a visit 5 times a day. And the person, you can get somebody to help you with your meals, you can get somebody to help you with your housekeeping, you can get someone to take you for an appointment or help you do your grocery shopping. So that's been an incredibly positive program. So that overall, in a nutshell, I could go on and on, is the senior strategy.